Hi, this is the third video in this series on anxiety disorders and obsessive-compulsive disorders. And what you're looking at here is the diagnostic criteria for generalized anxiety disorder from the DSM-5. And this is pretty self-explanatory. There's not a lot of mystery here. This is when somebody is worrying a lot. And it's not when somebody's worrying like a mother whose son is deployed, or if your partner's deployed and there's active, there's combat going on, and of course you're worried, and you're worried all the time, and maybe you can't sleep. This is about excessive anxiety that is not, it's about a number of things. It tends to be a person who's worrying about everything. It can be about a few specific things, and they start becoming symptomatic. And that's the key here, right? We're never talking about disorders in order to label somebody or to say that somebody's not normal. We're trying to figure out ways to help people. We're also sometimes trying to figure out a line where the suffering might be beyond what is expected for somebody to deal with alone. Now, nobody should ever have to deal with anything alone, but at a point where we can expect therapy to be helpful. How's that? Therapy, and when I say therapy, I mean all the therapies, including drug therapy, if that's what's desired or necessary. So with generalized anxiety disorder, we're once again seeing the duration, 6 months, and we're seeing a list of signs and symptoms, 4 out of the following for excuse me. 3 out of the following for at least 6 months. So this, what's so interesting about anxiety disorders and generalized anxiety disorder in particular is that the person is both keyed up, so feeling aroused, and at the same time also feeling fatigued. And it's not a good way to be. It feels like worrying a lot so you can't relax, but you're also maybe not able to sleep and start feeling irritable and start having body aches and tension, a lot of neck tension, stomach aches, things like that. So you're going to see this more frequently in the people that we talked about who have high trait anxiety or high anxiety in their temperament. So this is going to be a lot more common for people with high trait anxiety. Okay, let's look at panic disorder. So in order to understand panic disorder, we have to understand panic attacks. And a panic attack is a surge of intense fear, and it's very uncomfortable. And it can peak within a few minutes. It can last for only a few minutes. It can last for up to an hour. Typically, though, no more than a few minutes. And we see at least 4 of the following. Often we see more of them. So like we were talking about before, palpitations, pounding heart, sweating, trembling, not feeling able to breathe, choking, nausea, abdominal distress. Sometimes people have diarrhea. Sometimes they might vomit. Feeling dizzy or lightheaded or faint, chills or heat, numbing, tingling. Derealization and depersonalization are interesting. Derealization is a type of dissociation, wherein one feels like everything that is going around you is not real. So people might say that they feel like they're watching a movie, or that it's a dream, but somehow it's not real. And depersonalization is a feeling that one is watching oneself maybe from the side or detached from oneself. This happens sometimes, or more frequently, I would say, with teenagers. It's more common in adolescence, more typical. And you may have had that experience when looking in the mirror for a length of time and suddenly seeing oneself as other. And fear of losing control, or people might say they feel like they're going crazy. So 4 of these are required for the diagnosis, but like I said, typically you will see more. And this is a state of extreme fear, and it is very uncomfortable. You'll often see people crying through a panic attack as well. So this is the diagnostic criteria for panic disorder continued. We have a note here about cultural specific symptoms: tinnitus, which is a ringing in the ears, neck soreness, headache, screaming, crying, and it says such symptoms should not count as one of the 4 required symptoms. So a little criticism of the DSM, acknowledging culture and then dismissing it at the same time. This is the DSM, this is not me, and I don't think that the DSM is a Bible either, so you can take that as you will. Now, here's the interesting thing. This is what distinguishes between just one panic attack or panic disorder. So, after an attack, typically it's more than one panic attack. So, a person has had a panic attack, maybe they were out in public somewhere, and had this experience of feeling like they were dying. Maybe they got taken to the hospital thinking that they were having a heart attack. Maybe they felt really embarrassed. And then suddenly it passed and there's nothing wrong, right? Because if it's psychological, then it's nothing, which I don't think is true, but that's what people often say to themselves. And then they, go on with their lives, not quite sure what just happened, maybe understanding that it was a panic attack, maybe not. And maybe they kind of calm down. And then a week, a month, 2 months later, they have another panic attack. Now what we see is a fear of having more panic attacks. This is back to trait anxiety. Remember how we said trait anxiety can change? It can also change during panic disorder. So it's kind of, I have a panic attack. Okay, maybe it's a one-time thing. I can keep going. I have 2 panic attacks. Now I'm terrified of having more panic attacks. I don't know when they're going to come. Typically, panic attacks are inexplicable. So the person might not understand why it happened at that moment and not at some other time. So it's also difficult to avoid if you don't know what's causing it. And now that the person is afraid of having another panic attack, their trait anxiety goes up. And guess what happens when your trait anxiety goes up? You're more likely to have another panic attack because you're closer to it, right? You're more anxious. We call that anticipatory anxiety. The anxiety that comes with anticipating another panic attack. And then people tend to get into a cycle. So the more concerned you are about having a panic attack, the more likely you are to have one, and the more you have, the more you're going to have. And this is where intervention is really good. It can really help the person. So sometimes what we see with panic attacks is agoraphobia. And when we diagnose somebody with a panic attack, we actually have to say with or without agoraphobia. I'm sorry, panic disorder, not panic attack. So when we diagnose somebody with panic disorder, we have to say with or without agoraphobia. Agoraphobia is a fear of going out in public. And it can occur along with panic attacks or as a result of panic attacks because now the person is afraid of leaving the house, afraid of going out in public, for fear of having another panic attack in public. So they start spending more and more time at home, and eventually the outside looms larger. It becomes more and more frightening the longer they stay away from it. And then we see panic attacks with agoraphobia. And here, intervention can be very helpful. One of the things that is very useful when somebody is having a panic attack is to let them know that that's what's happening and that it will pass. Because frequently people feel like they're dying, and which only makes them more afraid. I would never say you're just having a panic attack. I wouldn't want to minimize it, but I would also want to help the person understand that they're not dying. It will pass. It's psychological, it's important, and it feels terrible, but it will pass and they're not going to die. That's, of course, if you know that it's a panic attack. That can help reduce some of the anxiety and stop this cycle of fear and anxiety, because the attack itself is frightening. So there are ways of intervening in panic attacks to help people stop escalating out of control. I'm going to end this video here.